Hi, I'm Dr. Ted, and this is Fracture Friday. For this episode, I have a dislocated elbow. A pretty dramatic injury. Happens frequently with a fall on what we call a supinated hand, one like this. You see it in football players quite a lot, especially offensive linemen, where they get knocked over, a player that's already knocked down, and the player being knocked over basically puts his hand out to protect himself and dislocates their elbow. Offensive linemen have to be very large individuals, so the forces are bigger too. So this first x-ray is an AP of a dislocated elbow. It's pretty dramatic. You can see that the elbow, the proximal aspect of your radius and ulna is no longer basically in its proper alignment with the distal aspect of the humerus. Okay, so here's a lateral of the same thing, and you can see that the proximal aspect of the radius and the ulna, your forearm, is posterior to the distal aspect of your arm or your humerus. So what do we do with this injury? We basically close reduce it, and that's what's happened here. So here these post-reduction x-rays show an AP of a relocated normal looking elbow, and then here I have the lateral of that same thing where the elbow is back where it belongs. So in this particular case, what we do, or what we did, was that we put the elbow through a passive range of motion while the patient's still anesthetized, whether it be in the emergency department or in the operating room, and see if the elbow maintains its stability. So if we put the elbow through its range of motion and the elbow doesn't pop back out, we just basically put the patient in a splint for a couple weeks and then start early active range of motion, and they heal relatively quickly. If the elbow does pop back out, then it's more of a long-term immobilization in the form of an elbow orthotic, which is a hinged orthotic. We basically lock it at 90 degrees for about 2 to 4 weeks, and then start range of motion from 30 to 100 degrees, and then increase that slowly over time as the ligaments in the elbow heal. Hope you enjoyed this video. Thanks for watching. Hi, Dr. Ted. Thanks for sticking around after the video. If you'd like to see some more content from us, please subscribe to the channel and like this video.